Well, hi guys, Chad Gouveia from Carl Broman Respiratory Care Services. I just wanted to share with you a particular type of taping technique. What we find on some of our patients here at Carl Broman, I'm going to tilt this down just a bit, is these securement devices for some of our patient sizes just won't work. So this is an adult and this is just too big. And then our other option is to go with what we use for our neonatal folks, and this is just too small. Okay, so what do we do in these instances? Well, I wanted to share with you this 3M multi-pore dry tape that we just received. And I'm going to share with you kind of how we could use this to secure this endotracheal tube. The first thing we're going to want to do is to pull off about a 5-inch piece here. So we're going to do that. And we're going to use our scissors. We're going to cut that off. And then we're going to measure out a piece that's about 1.5 feet, somewhere around there. So if I step back, about that long. Okay. And then we're going to use our scissors, and on each end, we're going to cut this in half, down about 8 inches, so that you have two separate pieces. So right down the middle here, on each end, about 8 inches down. And then we're going to remove the backing and take that 5-inch piece tape. And we're going to put that right in the middle once we have removed this backing. Okay, what this is meant to do is to go underneath the neck and not adhere to the back of the tiny hairs on the back of the neck. So it'll keep that from pulling. Okay, for the sake of time, I have one ready to go. And I wanted just to show this to you. So in this instance, I'm using a comb, but a tongue blade is ideal. What this is for is to help you scooch this underneath the neck so it doesn't get crumbled or glued to itself. So I'm going to do a bit of this underneath the neck. There. Then I'm just going to take my comb off. And what you're going to see is, of these two strands on this side, there's a bottom one and there's a top one. I'm going to go ahead and grab the top one, and that's what I'm going to use to wrap around my endotracheal tube first. Okay. Go like this. Oops. I'm going to go around once ought to do her, and then back up on the lip and across. And there's going to be a reason I'm doing that. Now I'm going to take this bottom strap and I'm going to go over this to hold this in place. Okay? Now I can come over here on this side, and I got a little together on that. And we're going to repeat that. And what this is going to do is make this baby is going to be super secure, and it's not going to go anywhere. So I'm going to come around here. We're going to go around and then back over and take my final, and we're going to come all the way across just like that to hold it in place. And I'm telling you what, this method, this baby's secure. I appreciate you guys watching. Stay well out there.